one last question, because I know we have to dash off, but you know, electronic medical records have been something that's been pushed very heavily on doctors and practices now, very costly. Even if you got involved with the reimbursement from the government, right, it's a big outlay of money. And I'm personally in it myself for the second month now, and lots of hurdles, lots of problems, extra staff being hired, extra hours afterwards to get various histories in and scanning, and it goes on and on. But I'm just wondering, I heard a talk show recently where somebody was saying, boy, they're starting to see what doctors are going to be in the future, and it's not going to be that doctor-patient relationship that we've all come to love over the years, but really more information managers. And boy, when I heard that, I'm thinking, I can't think of anybody in our society that really wants to be a computer information manager. And so can you give me any insight as to, you know, with a thought in the Capitol about doing the patient-centered healthcare, trying to get that patient-doctor relationship to be kept intact?
Absolutely. But electronic medical records and information technology in healthcare is absolutely vital and important, and we need to have it move forward. But it doesn't need to move forward with Washington making the decisions about what it ought to look like. Yeah. When Washington decides, it decides things like meaningful use, which the meaningful use criteria. So you've got doctors across this country or their staffs who are now making certain that they check this box and that box and make certain that that portion of the electronic medical record is including what it needs to include so that Washington is happy, not so that the patient's happy. We need to get back to where we are doing the best quality care for patients. And Washington will never get there because each individual patient is different. So is there a role for an electronic medical record and information technology? Absolutely. Is there a role for Washington? You bet. But that role, I believe, ought to be limited to deciding what the platform's going to be. What highway are we going to drive upon as we exchange this information? And once that happens, then let doctors and hospitals and clinics and entrepreneurs get out there and figure out the best way to allow that information to be exchanged. And the patients, once they're able to control their health coverage, their medical dollar, they will gravitate toward the folks that are doing the best job, and you will be able to make it work because it'll be responsive to patients, not to Washington.
This is a perfect segue for my last question, and the members are going to want to know what they can do locally in their communities with their representatives, even if they happen to travel to the Capitol. But what would be the best way for them to get our concerns out to you and to various people on the Hill?
Well, John, it's so important, as you well know. Political involvement is absolutely vital. If you're not involved in this process, then somebody else is, and it's very likely that that person isn't representing the kind of issues positively that you would like to see represented. So if taking care of patients is important, which it is, clearly, and you recognize that Washington has been terribly involved in making it more difficult for you to take care of patients, then you've got to get involved in the political process so that you can advocate on behalf of you and your patients. The way to do that, politics is no different than any other business. It's all about relationships, which means that you gotta know who your state senator is, your state representative. Make certain that you're communicating with them. So many things are happening at the state level. Get involved in ways of either supporting somebody actively on a campaign. Find somebody that you think is representing folks well, and get out there and work for them. It's almost as easy to get in touch and to develop those relationships with your member of Congress. A little more difficult, sometimes a little more difficult with the United States Senator as well, but the goal ought to be when a health care issue comes across your representative's desk or your state senator's desk, that the first person they think about is you. That's the level of relationship that you want to have. If you do that and you're advocating on behalf of your patients, then I have no doubt that my colleagues in Washington will get the message that we need to move away from Washington running the show and need to get back to patients and families and doctors.
Well, I really want to thank you on behalf of the North American Spine Society. I know this is a lot of time out of your day and week, but we really support your efforts, and thank you for everything you're doing.
Thanks, John. Appreciate it.